So this is a recording of a presentation by physical therapist Jacob Ossie and Sean Regan, talking about the prevention of the athletic shoulder injuries. It's presented by UCL. Um, the objective today is going to be to expose our parents and our players to the basics of shoulder anatomy, kind of identify some likely injuries that our high school players may experience, and identify possible modifiable risk factors for those shoulder injuries. Um, as we do that, we're going to discuss technically, scientifically supported methods um, that will actually help us potentially reduce that injury to help our athletes stay safe and stay in sport. First things first, we need to talk about kind of what are we looking at here, right? When we talk about a shoulder, it could be all sorts of things. We're talking about the bones. So we're talking about the humerus, basically your upper arm bone, your scapula, the shoulder blade that kind of is going to articulate with that humerustic form of joint, your clavicle, so your collarbone, and then the spine that connects everything all together. When we look at that shoulder, it can be a couple of joints. We can look, you're looking at the glenohumeral joints, that general ball and socket that we're looking at. Our AC joint, so where the shoulder blade and the clavicle come together, as well as that scapular-thoracic joint. So how that shoulder blade actually can move on your thoracic can very much manipulate how your actual shoulder feels and how well you perform. On top of that, we have a labrum. So that kind of basically grabbing onto that shoulder, holding it in there, some of the passive tissues that hold on, some ligaments, and then a series of muscles that are going to keep that shoulder nice and mobile, as well as nice and strong. Looking at our rotator cuff, some scapular stabilizers, and the bicep tendon itself. So first things first, kind of how common are these shoulder injuries? It's going to really depend on who you ask. We have a lot of ways of measuring it. Sometimes they're not quite so good. And sometimes the data is not necessarily as well supported as we'd like it to. We also need to look at what sport the athletes themselves are participating in. Our injuries related to a football player are going to be exceptionally different from, say, a softball pitcher. And then we need to look at what those athletes' training and their development looks like as far as the series go. I don't expect to see the same injuries in my 12-year-olds as I do in my 35-year-olds, even if they're playing the same sport. A study that came out in 2009. So, a little bit older study with a smaller school and looking at all their Olympic programs. This did not have like a football program in there. They said about 30% of their athletes were going to have shoulder injuries at some point during the season. That include their baseball, softball, swimming, tennis, and volleyball players. Again, all overhead, all using a lot of shoulder work. But potentially we're looking at, a third of our population having some problems. The breakdown was a little bit all over the place. And so, 20% of them said they're going to have something called a subacromial impingement, where basically that shoulder is not as stable as we'd like it to be. And so it's not as coordinated as we'd like it to be. And we can kind of get some pinching of the rotator cuff in the shoulder. 24% say there's a rotator cuff tendonitis. So again, that rotator cuff, about 50% of our athletes are saying they're having problems with them. 12% are going to say more of a bicep strain. 9% saying periscapular, so around the shoulder blade muscles were injured. Following that, we had about 8% with a superior labral anterior to posterior tear, and then 8% had a little bit of instability, and 7% had about a joint injury, AC joint injury, which we generally can associate more with contact or falling. The contrary, on the flip side of this, there was a more recent study looking only at quarterbacks, but it looked at a 10-year history of these guys getting injured. Again, we're looking at one position of one sport, but they had a very different injury pattern, right? We're seeing a lot of those guys getting AC joint sprains where they're basically just being kind of dropped on that shoulder. They can really separate everything in there and cause some pretty significant pain. 9% were just bruised up. 7% actually broke their collarbone. 5% ended up dislocating their shoulder, and then another 4% ended up with a rotator cuff tear. The question kind of becomes what we can do about it, right? If we're looking at those AC joints, those traumatic injuries, the best thing I can tell you is don't get hit. At the same time, there is some evidence out there to say that if we do these things, people get better. This study published in 2020 is a really great, basically across sport, across discipline evaluation of what our athletes are actually doing and what's going to actually keep them less likely to get injured. And it kind of basically came with the idea that shoulder injuries are multifactorial, right? They can be exceptionally difficult to predict because there's so many things that can go into that. We know our sports are always going to be different. We shouldn't necessarily treat our volleyball players the way we treat our baseball players. We know our athletes are going to be different. And then we know that dumb luck eventually gets a say. Sometimes you just have an unlucky day and you end up injured. With that said, we have some things that are going to be an unmodifiable risk factor, right? So if I've been injured and my shoulder's hurt before, I am much more likely to get injured again. It's much more likely that my shoulder can get tweaked up again. Um, Unfortunately, a lot of our ladies are more likely to get hurt because of multiple genetic factors, because of multiple sport demands. Age can sometimes be an indicator for if my shoulder's going to hurt. You know, a lot of our athletes that have been really using and abusing their shoulders for a long time are probably going to be more likely to be injured, as well as some of our young athletes who haven't necessarily developed some of that strength or some of those positions to keep themselves safe, maybe more of a risk factor for injury. And then lastly, we have that sport specific position. You know, we know that our pitchers are probably going to be much more likely to get injured than our outfielders. It's just different demands of the sport. They don't have to be throwing at 90 miles an hour in the outfield. With that said, that's not always going to be a modifiable risk factor for some of our patients. Some patients must be pitching because that's what they're best at. And so it's one of those things to consider as we're evaluating that athlete, but it may not always be a changeable thing. Some of our more modifiable risk factors, something we can actually do something about. We're going to be looking at muscular weakness and, you know, our agonist versus antagonist imbalances. So is the front side about as strong as the back side? If there's a huge difference between the two, we're going to be at more likely a risk for injury. We're going to also look at that scapular coordination. How well is that shoulder blade actually moving on your arm? If it's looking a little funky, if it doesn't look as stable, if we see some winging or anything like that, which you'll see with some of our younger athletes especially, they can be at a higher risk of injury. And then sometimes we see that range of motion may be a factor for shoulder injury. The evidence is a little bit inconclusive. Some studies are going to say, yeah, it's great. Some of them not so much. That's kind of going to be the hardware things that we can really modify to help our athletes do a little bit better. The other thing that we can mention, and will be mentioned more later today, is going to be that training loads and frequency. We kind of keep going back, especially with our baseball players, to pitch count. How many throws are they throwing in a game? If we have a certain threshold, they're much more likely to get injured as they go along. And so making sure we have a really good plan for these kids, making sure that we're modifying those loads and seeing how much they're training, making sure that we're not putting them in an increased risk of injury by having an intelligent plan and having some programmed rest breaks in there too. I'm going to hand this over to Sean at this point, who's going to talk about some of those strength factors and how we really approach that as a therapist or as a strength and conditioning coach.
Okay, thank you, Jacob. So Jake touched on some really important concepts here. Some of the things we can control is what we do for our training in the weight room, as well as on the field. One of the most important things we find, especially with young athletes, is the control of the shoulder blade and how it works together with the rotator cuff. So what we need to make sure is that the balance between those muscles is adequate enough to stabilize the shoulder inside the socket, especially with things like throwing and overhead activities, to provide that stability. If the stability is not there, over time things start to break down in terms of what the scapula is doing, and that puts you more at risk of having those types of impingement injuries, as well as labrum injuries. So what we need to strengthen this complex at varied ranges of motion, not just with the arm at the side, but we need to put it in all different positions, because that's what happens during sport. And a lot of times we don't know what's going to happen during sport, so we need that reactive strength. So we talk about the importance of doing closed chain and open chain exercises, and also integrating the shoulder with the core and the lower body at the same time. This just gives us a picture of the rotator cuff muscles. It gives us a little picture of the acromion, which is that AC joint Jake was talking about. Kind of a quick anatomy view of what's going on in there. At the bottom here, you can see the actual socket where the ligaments and the labrum would be sitting. And labrums are definitely going to be one of the most common injuries for ages 14 onward. So open chain exercises are some of the things that we typically think about, just doing lateral raises with a dumbbell, or using a band or a cable to do shoulder external rotations, some of those things that might be More well-known, there's a series of exercises called the Throwers 10, which is a bunch of exercises to work on that scapular coordination. And we also talk about doing carries. So that's where you're doing holding weight at the side, walking around, and challenging your core. And you want to put those weights in different places. So you can do overhead carries, and you can also do carries at mid-range, which we'll see a video of. As far as overhead press, the thing with those, they are quite healthy if they're done correctly and if the athlete has full range of motion. If you're going to be performing a sport where your arm is overhead, then it makes a lot of sense to have strength and coordination up there. And it does not have to be with a barbell, and it doesn't have to be Olympic pressing. We do like kettlebells, dumbbells, lots of things that, again, challenge that complex in varied ways. Closed chain exercises are going to be where the hands are in contact with the floor or another surface, such as a medicine ball, stability ball, or the wall. So what happens here is, let's say you're doing a plank or a push-up variation, your core muscles have to work automatically in order to keep your spine and scapula in good alignment. So if you put yourself in that position and you're challenging the directions where your arms are going, again, there'll be videos towards the end here, and you'll be able to see how everything needs to work together. So if I'm going up to block a volleyball spike or a basketball shot, or for sure throwing overhead, having that ability to stabilize is key for injury prevention. So some examples of these closed chain exercises would be, like we said, push-ups, plank variations. You can move a leg or move an arm so that you have 3 points of contact on the floor with a push-up or a plank. We also like crawling exercises. There's a video of Jake doing a forward crawl. These are phenomenal for helping you ground your hands into the floor, which makes the muscles work reflexively, meaning how they're designed to work. So when you get in that position, you have to stabilize everything from your core down to your shoulders, down to your feet and your knees. So we like doing those in varied directions. There's a little bit of a cardio benefit to it, coordination. So those are pretty phenomenal. I think a lot of times not utilized enough. Wall slides are another good one. Here you're putting, you can do these in varied ways, but you can put your arms against the wall using a band when you're ready. You can perform those T's and Y's type exercises if you want. One of the keys we're looking for is to help strengthen the serratus muscle, which is on the front of the rib cage, and that helps to control the shoulder blade as you're moving around. So how do we program this into our weight training? First of all, with warm-up, you definitely want to do 1 or 2 things to kind of activate the shoulder and the rotator cuff muscles. Again, any of those examples would work, but you don't want to overly fatigue it if you're going to be going into a strength and conditioning program from there. So just enough to make sure everything is activated. After the weights, then you can do additional exercises. Fatigue is not such a problem here because we've already done our main movements in the weight room. And those can also be done on off days for just maintenance and further prevention. So with the weight room, an easy way to think about this is your push-pull ratio could be 2 to 1, meaning you want to do more pulling than pushing. So if you're going to do a dumbbell press, you'd want to do a row as well as some kind of a pull-down exercise or a pull-up exercise. Lots of variations can be done. It's kind of an endless list. Just some examples, TRX rows, barbell rows, dumbbell rows, all those types of things could be programmed in. That would be with the strength and conditioning coach there. And again, we're talking about why are weighted carries so important. So these muscles work together as a functional unit. So if you have to carry something heavy on one side, your body's going to want to bend toward that side. So now you have to use your core on the opposite side to hold you up. You're even going to use your hip and even your ankle to stabilize. So it's a great way to add conditioning, injury prevention, and get some strength endurance, meaning you're using your strength, but under, let's say, a 1 or 2 minute set. So those are the types of things that we need on the field. A couple examples here that we just took in the clinic, and you can look at these videos at your leisure. But this is just going to be an example of what we call a waiter's carry or a pizza carry. If you like pizza, you'll get the idea. And here's Jake working on an overhead lunge carry. So that's an awesome one for the legs, and holding that shoulder up and stabilizing it overhead. These are going to be some of your push-up variations, shoulder taps. So we have to stabilize everything while moving. Jake's yelling at me. And then the Ys and Ts can be done while in this position. These are really tough. Builds a lot of stability and endurance there. So you could do those for time or for reps. Some other considerations, the bench press is not always the best choice. We do encourage working with dumbbells, even doing single arm dumbbell press. Unless you're a power lifter, you may not need a lot of time with the bench press. It is a good overall strength builder, but it's very easy to overtrain, especially if you're not working the muscles on the back side of your body, as we talked about. Equal strength on both sides is huge. With pitchers, we'll definitely see a very big difference with range of motion in the throwing arm versus the non-throwing arm. That's typically not very modifiable. We want to have a difference there, but we want to make sure the strength is fairly equal between each side. A simple test is if you go on one knee and you're pressing a kettlebell or a dumbbell overhead with the right arm, and then with the left arm, you want that to be pretty close to equal. And if not, it's kind of telling you there's going to be a muscle imbalance that you want to address. And in my, the way I would say train somebody is, you probably don't need to be doing heavy barbell overhead press if there's a significant strength difference right and left, because that's just going to set you up for asymmetries and possible injury. Again, we talk about single arm dumbbell, bench press, and floor press are also great variations. Shoulder problem is rarely just a shoulder problem. So, when somebody comes in with a shoulder issue, we're looking at neck, we're looking at thoracic spine, which is the mid-back, where we need to have mobility. We're looking at their core. We're looking at basically everything that's going on to figure out where the actual symptom is coming from. Super important. We want to avoid overuse and early sport specialization. So, we really don't want kids, and this is supported by the literature. They should not be playing the same sport year round. This has become an issue in the past several years. In our practice, we've seen examples of this, and it unfortunately leads to injuries that really don't need to happen. We want to allow adequate recovery time. Just because somebody's a little younger, the body still needs to recover. Dr. James Andrews has talked about this at length in the literature, and he's going to suggest at least a month each year where our kids are not involved in a competitive sport. So, just doing normal activities and doing various cross-training types of things so that we're not performing pattern overload. We cannot be throwing 12 months out of the year, or it's going to lead to trouble, and it's certainly going to decrease the durability if our goal is to maybe get a college scholarship. We don't want to throw the arm out before that even happens. So we want to diversify the sports and activities that our young athletes are involved with. And, finally, don't hesitate to be evaluated by a professional. So we have some great orthopedic sports medicine doctors here at UC Health. And, we communicate with them as physical therapists. Even if there's a small bit of pain or something doesn't feel right and it's limiting your function in athletics, let us take a look. We tend to see things, differently than than the docs or the strength coaches, and it's worth the time and effort to get it done. So we are here to help. We love this stuff, and we're hoping that we can keep our athletes healthy for the short and long term.
For anybody that's curious about our references, they're attached here into the slides, and we are going to attach that PDF of the Throwers 10, which again is a basic just introduction to shoulder health exercises that should be done for probably just about everybody to keep a happy, healthy shoulder. Thank you.
Thanks, guys.